PET scan. Okay. I know in the last visit he said you can talk to her.
Yeah.
so if I'm
It'll
looking
probably
at
be
you,
the same
he
way
said,
in
I'm not
every,
interested in you, go talk to my wife.
Yes. We saw the video.
Oh, okay.
Yeah.
Just pulling his leg. So on the PET scan is different from a CAT scan because it lights up wherever there's cancer.
Right.
Okay. So he has multiple lung spots, okay, which are consistent with cancer in both right and lower lung. Lot of spots in the liver and in the omentum, which is the covering of the belly.
Have you got a picture of the PET scan?
That will be at United Regional.
Okay.
Yeah, actually, as you're here, they will rip a copy and give it to him.
Okay.
Because HIPAA violation he has to.
How many spots in his lungs did he have?
Multiple bilateral, they just measured the largest, but
What was the largest size?
Largest size was about 2.5 centimeters in the left lower lobe.
Even with 100% oxygen, that's what it read
Yeah,
today.
because think of it this way. We have two big lungs, okay? And if you're not a marathon runner, there are people who have a normal life with one lung, right? And you're at rest.
Part of a lung.
Yeah, you're at rest. She's checking her saturation when you're comfortable sitting, If you run for it and then she checks your saturation, it'll probably be lower. So most of us do not have that active a lifestyle where you need the supreme lung function, so we can adjust. Same thing with the liver, we don't need the entire liver function to carry on with our life. You're not going to get jaundiced with, that is why you can carry on like this.
Well, am I supposed to get feeling better and getting healthier every day?
Probably not, but
yeah, every day I'm getting stronger and feeling better.
The surgery and all that side effects will go away, right? So you'll feel better from that point of view. Yeah.
Did it say what the largest size on the liver was?
The liver.
There was 2 points.
Let's see, 5 centimeters.
So how many spots total?
They
don't count.
Once there are a lot, they can't count.
But they said there's a lot of them?
Yes,
Okay.
that's what they mean, So the largest is 5 centimeters in the right lobe.
So,
and below it is another 3.2 centimeters, Most of them seem to be in the right lobe. And then they say multiple omental mets. And the largest is in the left lower quadrant, about 2.4 centimeters. I would say a little bit more than an inch, that's about it.
And then you said in the lining of the belly?
That's the omentum. So there's a curtain.
So between
there's a curtain.
Muscle?
No. So there's a curtain kind of thing where blood vessels supply your colon and your intestine.
Okay.
So that's called the omentum.
Okay.
So
between his stomach and his colon?
No, abdominal wall and his gut.
Okay. All right.
so how long am I supposed to live? 2 months?
That's
6
difficult.
months?
How will I know how long, right? As long as you live, as long as you're feeling good, it's a good thing.
I feel
So
good.
think of it this way.
I feel bad. If it wasn't for this bag, have to pull this bag, I feel about as good as I did before I had the surgery.
Yeah.
I'm gonna get out and work, and I'm cleaning carpets every day.
You need to do what you can do, and that's a good thing because
I
I
feel
want
good.
you to have as near a normal life as you can. Just because I walk in and I tell you there's cancer here, cancer there, I don't want you to sit in a corner and wait for symptoms to happen.
Can those be removed?
So for suppose only his liver was involved and only the right lobe or the left lobe we remove. I have several patients but we are talking about multiple spots here, multiple spots here. There's no way that's why we talk about chemotherapy.
Oh.
Yeah, because it flows through the blood and attacks cancer cells wherever they are. Not curative, but will slow down the process.
And I remember you saying vaguely in the last video or in the last session that immunotherapy was not
So upfront immune therapy is given for patients who have microsatellite instability, which we
Okay.
point towards a genetic issue, and if they're MSI unstable, we can give immune therapy, after usually they don't do as well with frontline chemotherapy, and then we give immune therapy. They do pretty well with immune therapy if they have that specific.
Yeah. Yeah, I've heard really great things about it, but I wasn't sure what the
Yeah, I've had
parameters
patients
behind
who
that were.
are in complete remission, so either way they do well. Okay, so that's what's going on with you, Mr. Wade.
Okay. You haven't shook me up a bit.
You have the same smile on your face, He looks pretty good, so I want him to do whatever he can do.
Oh, I'm super healthy.
Just do what you can. Do your carpet cleaning. Do your light.
You're a whole lot more worried about this than I am. I'm not worried about a bit.
And I think they are too. Yeah.
It don't bother me a bit.
So you live in Monday, right? Monday, Texas, or not?
Holiday.
No, Holiday.
Oh, the holiday.
Yeah, it's just right here, 5
Yeah.
miles.
So, as I know what his decision is, when and if, I want you to do whatever you can, as long as you can. And I don't know the answer.
That'll be for the next 10 years.
I
or
don't know
15.
the answer as to how long.
Yeah.
What is
10 years, I don't think so, but I'm not here to crush his spirit, okay?
what is the time frame on chemo? Let's say if that was
It depends. It depends on
as
how
far as
much.
when he
So-
needed to start that or whatever in order to.
We generally want to start it when the liver function is still good enough to tolerate. Like suppose somebody is jaundiced and all, by then the liver has failed completely.
Do we know the liver function at the moment? Is it?
He's not jaundiced, so I know it's fine. I mean,
Okay.
it'll probably a little bit off for sure, but he will be a candidate for treatment,
Sure.
Yeah. Like example, I don't know today's, but if you see his this thing.
And
We
with as
could
many
go ahead.
spots as he has,
Uh-huh.
what is the duration of chemo? Radiation?
Pretty much with no radiation. With colon cancer, which is metastatic, they're on chemotherapy throughout their life. So the way we start is we start with multiple drugs, and upon maximum response or side effects, we drop off
Adjust it
some
from
of the
there,
drugs
sure.
and put them on bearable maintenance treatment, I have patients who have been treated for 4-5 years. Average survival is 22 to 24 months, but in every colon cancer is not the same. So we see whether they have those genetic mutations, certain drugs you can't use if they have a mutation, etc.
Sure.
Okay.
Okay.
The reason why I mentioned chemo is I do feel he's in a good shape.
Yeah.
The scans you'll see and you'll think, whoa, but if you look at him,
Yeah.
He's still ornery, huh?
he is, hasn't changed one bit.
I can tell you lots of miracles of what people walk through. so-
And I say just live your life. And
I just told you a fraction of them. I mean, not even a fraction of them. I can tell you hundreds of them.
like we check that to see whether
I saw a man
there's
one
certain
time that
antibodies that can work. He has a mutation, so I know I can't use that antibody. So we try to tailor
What is
it.
the mutation?
KRAS. He's KRAS mutant.
KRAS.
Yeah.
I
So
don't know what that means.
yeah, it's just a mutation on your cancer cell.
And
So
is that-
let me know.
So where does that come from? Or do
The
we
cancer
do we
cells
know?
mutate. Yeah, that's cancer. That's why
What do you-
one
what do you
Don't
mean
know
you-
why
works.
it
One treatment works for some time, then they develop mutations and just like bacteria.
right.
You can't use the same bacteria
Right.
again. Just like breast cancer. Every breast cancer is not the same. Every colon cancer is not the same. Every lung cancer is not the same. So if someone says I have colon cancer and my doctor gave me an antibody, That's because they were KRAS wild type and the antibody will work, you know. So things like that. Okay?
Okay.
But let me know what I can do.
Okay.
Just because you're not on treatment doesn't mean. Okay?
Awesome.
Are
Thank you so much.
you from India?
Yeah.
Yeah. I like you. You got a lot of
I
compassion.
like you too. You know, you're always smiling, you know. And I want him to come, you know, honestly, in the big picture. We come in and we say all this, we show you a scan, etc.
Sure.
But honestly, one size does not fit all,
Sure.
you know. And he's pretty good spirited, you know. I want him to do everything he wants. Not for you. This thing is, we want to mollycoddle them and we are scared every
Oh,
time he
no.
says my
Are you-
hand
No.
hurts.
Have you been around
You think-
him?
No.
You've not been around him enough. There's no coddling him.
Okay, get to work.
Yes.
Okay? All right?
No, give him as
Yeah,
hard
but
a time as
Anything,
possible.
anything, do not hesitate to call.
Thank
Okay?
you so much.
And
Appreciate it.
just because it's not this thing doesn't mean maybe, you know, at some point there's something that I can help him with in holiday. Okay?
I do have a question.
Sure.
He had surgery on the 23rd of July.
Okay.
On the 23rd, 27th, something of August,
Mm.
he passed a white something from his
Mucus?
rectum.
Mucus.
It's about that long, looked
Yeah.
like it was solid. Was it
Yeah.
just
It looked
mucus?
From mucus,
Okay.
yeah.
Okay.
And I still pass wind every once in a while.
But
Okay.
I
Probably
don't,
it's not-
they didn't say what, if they sewed that other end together from the rectum
Probably
up or.
did. Yeah, but
So what
a
kind of-
lot of sometimes you can have a little bit of dark blood, you know.
So what kind of shape do you have to be in before they do the reverse surgery? I gotta have these spots gone?
Yeah. Yeah. Make sure
Okay.
that you don't get obstructed. Obstruction is a nasty thing to happen.
Mhm.
Yeah, because I don't like this thing, you know, so I'm gonna have
I
to,
hear you.
I'm gonna have to get healed before
Yeah.
they do the reverse. Okay.
And eat good nutrition. Okay.
Awesome. Thank
I'll
you.
be
Thank you.
there.
Thank you, ma'am.